Volker Wittmer has a problem many men have. His hair is getting thinner. The 57-year-old is suffering from the most common form of hair loss, androgenic alopecia, or male pattern baldness.
It started 4 or 5 years ago. I had a completely new sensation. I got a sunburn on the back of my head. I also noticed that I had a receding hairline at the front, and so I used some products and thought I'd be able to stop it. But I ultimately chose to go for medical treatment, and since then I've been taking medicine regularly. I believe it has greatly slowed down my hair loss.
Hair loss often negatively affects a man's feeling of self-worth. In many men, hair loss has genetic and hormonal causes. The male hormone testosterone is transformed in the scalp into dihydrotestosterone, or DHT. In hereditary hair loss, the roots develop an oversensitivity to DHT. The follicles wither and hair falls out more easily. Dermatologist Professor Stefan Graber.
In addition to androgenic alopecia, hereditary hair loss, another main form of hair loss is diffuse hair loss, which usually has to do with the scalp or the inner organs becoming sick. Then there is alopecia areata, a disease where the immune system temporarily blocks the growth of hair on the scalp in patches, resulting in hair loss.
The trichoscan is a diagnostic tool. Hair is shaved off in one place, then the area is dyed and later evaluated. The quantity and density of the hair is determined. The status of the roots is also assessed. The doctors want to know how active growth is, because the ratio between growing and resting hair determines what treatment should be used.
There are 2 medications with proven effectiveness for treating hereditary hair loss. The first one is minoxidil, a substance that is applied to the scalp locally. The other is finasteride, a substance taken in tablet form. Clinical trials were able to prove for both of them that hair loss could be stopped or at least slowed down. In individual cases, they were even able to stimulate new growth.
All kinds of hair loss treatments are offered online and through other media. Often they promise much and do little.
There are many alternative medicines and cosmetic concoctions to treat hereditary hair loss, but their effectiveness is low or entirely absent. One exception may be caffeine, which may be able to help slow hair loss. But the effectiveness is much less than that of the prescription options we use.
A surgical alternative is having a hair transplant. In this procedure, the patient will have some hair removed from the back of his head and individually transplanted onto the bald patch. This method is very labor-intensive. Engineer Volker Wittmer won't consider a hair transplant. He's quite relaxed about his situation.
At the moment, I'm very happy my hair loss has slowed down, and I just hope it stays the way it is now. On the other hand, I don't want to make too big a deal of it. It's not a disease, and I think it would be a bit ungrateful to life itself if I'd be unhappy just because I'm lacking a few hairs.
Volker Wittmer's self-esteem is not linked to the number of hairs on his head.